Good morning. This is Dr. Scott Jensen, Senator from Carver County in the Minnesota State Senate. Today is September 30th, and I want to follow up on a video I did last week. Last week I did a video and used the phrase something like this: I have never felt so lied to. And that was what I had received from a lot of different folks. Now, today, I have to piggyback on top of that because on the front page of the Star Tribune in Minneapolis, it says virus-related hospital admissions on the rise in Minnesota. This is exactly why I did the video last week. Last week, I protested when the Minnesota Department of Health decided to remove the statewide census data regarding how many ICU beds and how many hospital beds were being occupied by COVID-19 patients at that point in time on that given day. The reason that information is so important is because we were told long ago that the goal was to depress the peak, delay the surge, to allow our hospitals the ability to ramp up so that they wouldn't be overwhelmed if there were indeed a surge. Clearly, there has not been a surge like we had thought. Governor Walz had indicated at one time some 74,000 deaths and then reduced it to 29,000 deaths and then said that in mid-July we'd have 1,000 per day almost. And that hasn't happened. We've had 2,000 total through the entire pandemic in Minnesota, and 75% of those have been on long-term care. And I think we can honestly say that some of the policies put in place were responsible for the long-term care deaths, not to even mention the horrific suffering that we have put our long-term care residents through. But back to the point about the missing data. The Minnesota Department of Health last week made a decision that absolutely undercuts any perceived commitment on their part to transparency. Today we have a headline that says hospital admissions are on the rise. But what I don't know is in the context of we have 3,000 potential ICU beds in the state of Minnesota available if we need them. We can get there within 72 hours. 3,000 beds. Overall, we have about 10,000 hospital beds. So if I see that we're no longer using 300 ICU beds in this state for COVID-19 patients, it's down to 150. That makes me feel better that we're not approaching any situation where we would overwhelm our healthcare facilities. And if I see that out of potentially 10,000 hospital beds in Minnesota, we're only using 300, 320, 280, I'm not too concerned. If I hear that hospitals are running at 85% of their maximum, that doesn't concern me. I've been working in hospitals a long time. That's where hospitals want to be. We want to be running 80 to 90%. It's no different than a hotel. Hotels don't want to have 40% of their rooms used and 60% not. But the fact of the matter is, today, in this article, we see some interesting things. We see some exaggerations. We see the report that Tuesday, there were 870 newly confirmed infections. That's okay, because we only had 5 COVID-19 deaths, and all of them were in people over the age of 60, most of them in people over the age of 70, many of them in long-term care facilities. It went on to say that rapid infection growth in border states appears to have spilled into Minnesota. So now we're going to blame border states. Okay. Then it said North Dakota has the nation's highest rate of 513 newly confirmed infections. That's okay, as long as the fatality rate is dropping, as long as we're not overwhelming our hospital facilities, as long as the ICU census is dropping, as long as the hospital census is dropping in regards to COVID-19 patients, that's okay. Then the article comments on the ill-timed switch and how the Department of Health reports data. You're darn right it was ill-timed. It's not transparent, and it's keeping Minnesotans from thinking for themselves. I reached out to several senators last week, as well as hospital administrators and nursing home administrators. Nobody likes that this information is no longer available. Today, the Minnesota Hospital Association expressed concern also. Dr. Karani came out and said, hospital leaders felt it was the most important data point and want the health department to restore it, particularly with COVID-19 hospital cases on the rise. Folks, the critical thing that we're missing here is if we do have 7 admissions to the hospital in a given area or a given hospital or in a state, it doesn't matter if all 7 of those people that are admitted were admitted because they were going to have COVID-19 ruled out or ruled in, or if the patient was only in the hospital for a couple of days and was sent out. If in May Our COVID-19 patients were staying 10 to 17 days in the hospital, but in September, they're staying a much shorter period of time, and we're not using ventilators. Then we have a totally different situation. Remember, we talked about trying to depress the peak, delay the surge, and not overwhelm our hospital facilities. We're not. Hospitals are trying to ramp back up. I talked to some hospitals. They are going to have record-breaking losses this year. They want to be up to 85, 90% occupancy. Nobody is overwhelmed with COVID-19. Nobody is on a divert status. Folks, when the Department of Health said, we're not going to show you what the current census is in the state of Minnesota for COVID-19 patients in the hospital or in the ICU, they basically were telling us, we're not going to let you come to your own conclusions because we're not comfortable that the conclusions you come to are the ones we want you to come to. Honest to goodness, if you feel like you're being played, it's because you are. A couple of months ago when the Department of Health said, we're not going to show you the doubling times anymore, it was because we were looking so darn good. 4 facts. Cases are rising. Hospitalizations had been falling. ICU bed usage had been falling. Case fatality rate had been falling. Let's keep our eyes on the ball. We are not going to squash COVID-19. It isn't doable. And to hang our hat on the possibility of a vaccine is simply not the appropriate way to go. So, if you're upset with the lack of transparency, you should be. If you think you're being played, you probably are. And if people want to complain at the Department of Health level or bureaucrat level that there's too many people buying into conspiracy theories, let me tell you this. You're the one planting the conspiracy theories. Your behavior, your lack of transparency. Department of Health, you own this. Have a good day.